Welcome to SeniorFlix. My name is Ron Matheson. I'm the Director of Fund Development and Spiritual Life here at Shepherd Village. We're honored to have with us here today Anne, and Anne is our nurse practitioner from the Shepherd Village Lodge, which is our long-term care. We're going to be talking about palliative care today and getting a little bit of a better understanding of that. Welcome to the show.
Hi, Pastor Ron. Thanks for having me. I'm very happy to be here.
I have a few questions for you because I think I have. I mean, I've been working here for almost 15 years, and I think I have a fairly decent understanding of palliative care. And let me say, I thought I did until I started to read and understand a little bit more. What I'm really understanding is most of us don't understand palliative care very well, including myself. So help us get an understanding of what it is. What is palliative care?
Yeah, that's a great question. And I feel like in today's society, there's a misconception that palliative care means that we just stop all treatment and we just wait for the individual to pass away. But this is not true at all. So with palliative care, it focuses on meeting an individual's psychosocial, spiritual, emotional, and physical needs. It focuses on managing their symptoms, and it focuses on really maximizing their quality of life within the realms of their illness and as they progress through their chronic or life-limiting illness.
Okay, that's great. Maximizing their quality of life. I really like that term when you talk about, you've talked about a couple of things before in our conversation. One was quality of life. And I think there is a feeling that when you come into long-term care, you are moving into an area of palliative life. Is that, can you address that? Is that true, false, or partly true?
Well, we do, in long-term care, we do focus on a palliative approach to care. Again, that means that we are, when you're entering long-term care, you obviously have chronic illnesses. There's a reason why you're entering long-term care. It may be difficult for you to manage things on your own out in the community. So with you coming to long-term care, we do acknowledge that you have chronic illnesses, and we try to maximize your quality of life while you're dealing with that illness, right? Within the realms of that illness.
Yeah, that's actually helpful to know too. Talk to me about quality versus quantity.
Right. So a good example of, for example, a palliative approach to care, you could take someone with an individual with a terminal cancer diagnosis. Now, if that individual were to go to full medical management, they may choose to undergo things such as chemotherapy or surgery or experimental medications in an attempt to prolong their life, even if it's for just a few months. However, that route may come with its own complications and side effects that may actually affect their quality of life, right? They may end up feeling more weak or tired or constantly in the hospital, and it may not be the way that they imagined, living the rest or the remainder of their lives. Versus if they were to go with a palliative approach to care, they may decide, okay, I want more conservative management. I want to manage my pain. I want to manage my symptoms so that I can continue to live my day-to-day life and continue to enjoy my hobbies and activities and sort of maximizing or maintaining their current quality of life as they go through their illness.
So if you were, and what I'm sort of picking up from you is that most people, and I'm thinking about my future as well as my mother as well. My mother is on her own she's in an apartment, and some of the family are there and around and with her and taking care of her and so on. But she's still very, very independent.
Right.
So she's not really at a place where she's needing ongoing medication and or doctor care any more than what would be fairly normal in an elderly person's life. However, the next stage would be when she can't manage that. Would that be sort of where she moves into a long-term care and more of palliative, or am I misunderstanding a little bit too?
Right. So really, at any stage of a chronic illness, you can implement palliative and a palliative approach to care.
Right.
Because remember, it's about managing symptoms, right? It's about
Right.
meeting their psychosocial, emotional, and physical needs.
Okay.
And it's about maximizing their quality of life as they progress through that.
Right.
So even if you're not if you don't need long-term care, that's okay. You can still want a palliative approach to care, which just means that, hey, if I have pain, I want that pain managed. Or if I'm having shortness of breath, I want that managed, right? It's focusing on maximizing your managing symptoms and maximizing your quality of life and meeting your needs so that you can continue to live your day-to-day life.
Right.
Yeah.
So it's not about how long you're living. It's about
Right.
how you're living and
Yes.
helping you to have a good quality of life.
Right.
There's end of life.
Mhm.
Talk to us about the difference between palliative and end of life, because I think a lot of us sort of get that feeling once you've moved, and I used to think this way when I heard someone is now in palliative care. It's like, oh, they're at the end of the life.
Right.
Probably got
right.
30, 40 days
Yes,
to live.
yes.
Talk to us about that.
So end of life is the sort of the last moments of life where they're imminently dying, or they have their time is very limited, right? They may have like a few weeks or days. That is end of life. But palliative care is just, again, managing symptoms. You're wanting, the goal of palliative care is to maximize your current quality of life or maintain your current quality of life by managing your symptoms and meeting all of your needs, right? It's like a holistic approach to care. It's not focused on, all of this medical management with the focus of prolonging the quantity of life.
Okay, yes,
right?
yes.
So, and
Yeah.
again, palliative care can start at any stage,
Right.
It's not meant for like end of life.
Right.
It's focused on holistic care, right?
End of life, well, even with palliative care, there are limits to what a person really should do and maybe shouldn't do. What piece of advice would you give to people when it comes to advanced care planning?
If I could give an advice to people, it would be to discuss death with their loved ones, right? Death and dying, it's a guaranteed event that's going to happen in life, right?
Right.
We will all go through it. And it's really important to let your loved ones know what you would want in the event that you are unable to make care decisions for yourself and you're unable to speak for yourself. So a lot of people may think that, oh, we have to do everything to prolong our loved one's life, right? But this may not be what they want, especially if there's no quality of life with that, right? So it's really important to have these discussions, and it will save your family from a lot of guilt and, a lot of grief, especially when they don't know what you would want. It puts them in a very difficult place because they may feel that, oh, I'm not sure if they, would want to prolong their life, but they may, because they're unsure, they may choose to do things like adding a G-tube or putting you on ventilation, things that you may not have wanted.
I'm picking up that's actually a huge question. And maybe we've come to the end of this first session. Maybe we could pick that one up on our second session, where we can talk a little bit more about the advanced care planning and why some of this stuff might not be what you would want for yourself or for someone else.
Right.
Thank you for joining with us.
You're very welcome.